So hi, hello friends, welcome back to the channel. So today we'll be discussing the important part of clinical medicine. Okay, so topic for the day is cardiovascular system symptomatology. Okay, so what am I going to do in this session? One is I'm going to explain what are those cardinal symptoms pertaining to cardiology, as well as I'm going to take you a small trip to all the disorders of cardiovascular system at a glance. If you know all these things, an overview of this will definitely help you to remember all the causes of all these symptoms, as well as it will be easy for me to take you from basics to advanced clinical concepts. Okay, so ready? Take your sketches, get ready, come on. So come, let's go. So with regard to cardinal symptoms of cardiology, see, first symptom is, see this old man, he is abnormally aware of his own breathing. So when you are uncomfortable with your normal breathing, we call that symptom as dyspnea. Okay. So we will be seeing in detail of dyspnea in some time. So this is one important symptom. Next is, see this young man having this kind of symptom in the front of the chest. He's feeling the pain, chest pain. Next, see this old man, he is abnormally feeling his own heartbeat. Okay, that we call it as palpitations. See friends, whatever symptoms we learn, the basics which they expect from us is the definitions and the basic causes. Okay, see, next symptom is, see this abnormally swollen limbs, ankles, pedal edema. Next thing is, see this young man is fainting. This is known as syncope. Syncope is defined as a transient loss in consciousness due to reduced cerebral blood flow. Why it is reducing? It is due to decreased cardiac output. We will be seeing the causes in detail. Okay. So all these cardinal symptoms along with other causes we will see in detail. See, first thing is this small baby heart. Anatomical or structural defects within the heart since childhood, we call it as congenital heart diseases, that might be acyanotic as well as cyanotic. Okay, in detail we will be discussing afterwards. So these can cause all those symptoms listed above. Then see friends, this is a simple picture of a left heart. This is atrium, this is ventricles, and this is aorta. This is aortic valve and this is mitral valve. This a replica of this you can imagine for right heart, where tricuspid valve and pulmonary valve are there. So this is constructed with view of first years to final years. So I will be dealing with basics to advanced concepts. So what is happening here? See, this area of the myocardium is getting damaged. That might be due to extrinsic cause as well as intrinsic cause. Extrinsic means some blood supply to the myocardium is hampered, or some extrinsic infective foci or some sepsis are suppressing the myocardium to function normally, leading to those symptoms. So what are those causes? Extrinsic causes. One is reduction in blood flow, as we know it as angina, atherosclerosis in vessels, and if this progresses, that leads to necrosis of the myocardium and release of those cardiac biomarkers into the blood, which we call it as myocardial infarction. Okay, so infective causes infecting the myocardium, we call it as myocarditis. All these will be seen in detail. Okay, next, intrinsic pathology within the myocardium. Okay, any intrinsic pathology within the myocardium leading to abnormalities in the myocardium, it is known as, those disorders are known as cardiomyopathies. Okay, what are the cardiomyopathies which we know? One is due to defective structural protein in the cardiac muscle fiber. The muscle fibers get weakened and weakened, and the ventricles becomes prolongedly dilated and thinned out. So this is known as dilated cardiomyopathy. Can it pump effectively? No. So systole is affected. Systolic dysfunction is seen in dilated cardiomyopathy. See here, this is the left ventricular septum and here will be the right ventricle. Here the septal myocardium is getting abnormally hypertrophied, leading to what is this fruit here? Banana shaped ventricular cavity. Due to this abnormally hypertrophic septum, this will lead to some features, cardinal features, okay, like shortness of breath, chest pain and all. This cardiomyopathy we call it as hypertrophic obstructive cardiomyopathy, which we see in young age, or during exertion they will experience more of these symptoms. Okay. Next, what is the next cardiomyopathy? Some infiltrative disorders or some disorders replacing the myocardium, making the myocardium more stiff. Stiffened myocardium can't relax completely. So relaxation abnormality, that is diastolic dysfunction. Diastolic dysfunction is seen, and this cardiomyopathy is restricting the inflow of blood from the left atrium. So restrictive cardiomyopathy. Okay, these are the three important cardiomyopathies which we should know. Then what? Then see this friends, this heart is confused. What is going on? Actually, any electrical activity in the heart will be followed by a synchronized myocardial active contraction. Okay, so electrical activity means the electrical impulse starting from the SA node, traveling to the AV node, bundle of Purkinje fibers to myocardium, leading to myocardial contraction. Any abnormality in this conduction pathway or any increase in the rate of this production of these impulses, we call it as arrhythmias. These arrhythmias can also cause the cardinal features. Mostly they will cause this palpitations. Okay, arrhythmias, rate abnormality, rhythm abnormality, as well as conduction abnormalities. These might be tachyarrhythmias or bradyarrhythmias depending on the rate. If it is increased than 100 tachy, less than 60, we call it as brady. Nice. So these causes mostly palpitations, syncope. Okay, if it is due to MI, it might also cause chest pain. So all those symptoms will be in combinations. Next we are going to see with the valvular pathologies. What is the valve between left atrium and left ventricle? This is mitral valve is getting, the lumen is getting occluded. So that is we call it as stenotic lesions. Any stenotic lesions, what it causes, the myocardium there will undergo hypertrophy, increase in cell mass to effectively pump the blood through the stenotic valve. So hypertrophy will happen. Okay, and this is a pressure overload condition because pressure is increasing due to occluded valve. So pressure overload condition. Okay, what is the myocardium getting hypertrophied here? It is the left atrium. There is left atrial hypertrophy followed by prolonged. If it is prolonged, it causes left atrial dilatation and left atrial failure is going on, not ventricular failure. In mitral stenosis, left atrial failure is going on, leading to characteristic symptoms in mitral stenosis, which we will be discussing in detail afterwards. Then, why is this fish I have drawn? This occluded lumen of the valve looks like a fish mouth deformity, we call it as. Then, see, there is a perforation in the mitral valve. The mitral valve can't close properly, leading to regurgitation of blood. When it should be pumped to the aortic valve, it is not also pumping into the atrial side. So regurgitation phenomenon is going on. Regurgitation phenomenon is nothing but more blood is pumped into the left ventricle. See, all the blood pumped into the left ventricle is coming back. Sorry, all the blood pumped from the left ventricle is coming back, leading to volume overload. This volume overload will cause left ventricular hypertrophy as well as dilatation simultaneously. Okay, why? Because of the increased amount of blood, it will cause both things happen simultaneously and it will progress to failure also quickly. Okay, so left ventricle failure will contribute to those cardinal symptoms we discussed. Okay, what is this? Aortic valve is getting occluded, aortic stenosis. So what will it cause? See friends, during exertion, what happens? Our cardiac output should increase to match the increased blood flow to the muscles, to the limbs, everything. So what happens in aortic stenosis is, during exertion, the blood flow to the brain decreases, leading to syncope. Okay, next thing what happens is, blood flow to the heart decreases, leading to chest pain or anginal pain. Then, due to slow failure of the heart, that will also lead to shortness of breath. So exertion-induced syncope, chest pain, exertion-induced shortness of breath are characteristic triad of aortic stenosis. We'll be seeing more in detail, don't worry. What is this? This aortic valve can't close properly. There is a perforation here, leads to aortic regurgitation. All signs will be discussing in a single picture, don't worry. I'm just introducing you to the cardiovascular medicine. Next, see what is this covering of the heart? This is the pericardium. Pericardial pathologies, keep it at the last because they will be suspected only if the commons are ruled out. Okay, the commons are discussed above as. So this is the pericardium. This pericardium, if it is acutely inflamed due to infection or inflammation, we call it as acute pericarditis, leading to some characteristic pain there. We will be discussing. Okay, acute pericarditis or chronic calcification in the pericardium leading to abnormality in the relaxation of heart. It will push the heart. It doesn't allow the heart to relax properly. So that is chronic constrictive pericarditis. Okay, acute pericarditis, chronic constrictive pericarditis. And see here, any fluid accumulation in the pericardium leading to cardiovascular collapse. Okay, cardiovascular instability. That we term it as cardiac tamponade. See this punch. With this glove, I am punching this heart with this much amount of fluid. This heart can't relax properly. This can't receive the entire blood from the left atrium. So cardiac output decreases. That means BP reduces. Okay. So then if you auscultate over here in the chest, what will you find? You will be hearing those heart sounds muffled as if it is from a distance. So distant heart sounds. Then what will happen to the right heart? It can't also relax and receive all the blood from the superior vena cava, leading to dilatation of the jugular veins. So JVP will be increased, jugular venous pressure will be increased. So this triad is known as characteristic Beck's triad of cardiac tamponade. Okay, nice. So from here itself you can recognize like some acute shortness of breath, acute hypotension, all will be leading to these kind of situations. So the timing, duration, onset, aggravating, relieving factors, all these matters and all these decide your clinical diagnosis. Okay, so come, next thing is, see these balloons. What are these balloons? Aortic aneurysms. Okay, as well as this aortic intima can get torn, leading to seeping of blood through the layers of the blood vessel, creating a false lumen, that is aortic dissection. So see, these are some acute conditions. Why am I saying all these cardiovascular pathologies? Because from the next videos I'll be discussing the symptomatology in detail. So you should be able to correlate what's happening there. Okay, so this is a short trip of all the cardiovascular disorders. So starting from the cardinal symptoms we saw, then congenital heart diseases, and then with respect to myocardium, extrinsic, intrinsic, angina, myocardial infarction, myocarditis, and cardiomyopathies, dilative, hypertrophic obstructive, and restrictive cardiomyopathies. Then arrhythmias we saw, then valvular pathology, stenosis as well as regurgitation lesions, then we saw pericardial pathologies, and then we saw aortic pathologies. So this is a short trip. So from next videos, I'll be discussing in detail regarding the history taking of symptoms. Okay. So friends, if you really like these kind of videos, you can like, comment what and all improvements can be done. And if you really like us, you can subscribe us for more and more videos for you. All the best.